out for years, the time to start with these kind of financial plans is actually the time of diagnosis. You've heard of Medicaid? Okay, Medicaid is a government program for people who the state deems cannot afford to pay for care. Every state's different. Texas is kind of brutal. Okay, because Medicare is all about the finances. When it comes to qualifying for Medicaid, it's a financial consideration. That's why it is state planning. There are mechanisms, and I'm not an attorney, but there's mechanisms to look down the road and say, how many people have already purchased long-term care insurance? Most people have not. Without purchasing long-term care insurance, Medicare doesn't cover those caregivers. It doesn't cover nursing home placement. It doesn't cover memory care payments. That's all private pay, sometimes to the tune of 6 figures per year. You know, in-home 24/7 private caregiving, you saw the costs associated with what families are doing. Right? If you actually put a dollar figure on that, you know, per year per patient, it's well over 6 figures. Not many people have those resources, but they have enough resources to not qualify for Medicaid. So going through that financial planning and trying to project out, how do I qualify for Medicaid if the need arises 5 years from now, because Medicaid has a 5-year look back on your financial dealings, is probably one of the best advices I can give. Because people are, by the time you're shocked to hear that Medicare doesn't cover that care, it's too late. It's too late. So that's probably one of the best advices. The next advice from the doctor's side is going to be those difficult decisions. So the one that scares most people, but is actually a little bit more clear, is